I'm Marcia Xenatellis and today we're with Dee Backman-Hoyle. Hi Dee, how are you?
Really well, thank you.
Dee's from Inspired Workforce Performers, but today she's going to talk to us about mental health first aid training for managers. That's really interesting because we think about first aid training, but we don't often think about mental health first aid training. Tell us a bit more about that.
I think many of us are familiar with first aid training in a workplace, and for people who have been trained in first aid, it simply is, what do we need to do to support this person if they're physically injured until the right help arrives? Well, mental health first aid is in the same situation. What do I do to help someone who may be suffering from mental ill health until they can get to the right help that they need? So it works on the same premises as first aid training, but being aware that mental health in the workplace is very important, and mental ill health is as much a risk as physical health in the workplace.
So your focus is on mental health first aid training for managers. Tell us a little bit about what you do in terms of helping managers understand that.
Well, it's interesting. For the last 25 years that I've been working as an organisational development consultant and working very, very closely with senior managers and leaders, it's very appropriate to understand the role that the manager and the leader of an organisation has in the welfare of their staff. So what I mean by specifically working with managers is helping managers to understand the impact that they will have on the mental health of their staff, and they've got a substantial role to play in that.
That's very interesting. Is this a new concept?
Well, mental health first aid training has been around for a little while, and the mental health first aid training that I work with is for lay people. So it's not for clinicians and it's not for practitioners, and that is why it is absolutely perfect for people in a workplace. They don't need to become specialists to support someone with mental health challenges and mental health first aid in the workplace. It's been around for about 10 years. Originally put together by a woman called Betty Kitchener and Tony Jorm, and it's auspiced now under Origin Youth Research and Melbourne University.
Oh, that's very interesting. So what's involved when you go into an organisation and you're actually training managers? What does the training involve?
Well, let me take you through a little bit of a background on it. The training is rather extensive. It's 2 full days for someone to finish the mental health first aid training. And it starts off giving someone a very clear understanding of mental health conditions in the Australian environment.
Right.
And then we break it down into quite specific types of illnesses that can occur. And then we look at what someone can do to support someone who may be suffering. The statistics are 1 in 4. It's really unlikely, if you're managing a group of people or inside an organisational setting, that there won't be someone currently suffering from a mental illness or recovering from mental illness and needing to rehabilitate back to the workplace.
And I suppose there's skills that you could learn that you could apply to any social situation, any committees that you're part of, that once you've done this training, it makes you more alert as looking for the signs and what perhaps you could do.
Oh, absolutely. As well as being in a workplace environment, we will unfortunately at times need to support people in places other than our workplace. So it gives us the ability to understand the correct communication skills to apply when someone's demonstrating the signs of an illness.
So Dee, if somebody was listening to this right now, how could they go about contacting you to find out more about doing this program?
Well, the easiest way would be to jump onto the website, which is www.iwpa.com.au, and press the Mental Health First Aid button, and we can connect with you and provide more information to you.
We've been talking with Dee today from Inspired Workforce Performers. Thank you very much.
Thank you.